So we're going to demonstrate lower extremity screens, and we're going to do dermatomes, myotomes, and reflexes for a neurological evaluation of the lower extremity. With our dermatome patterns, we're just going to do light touch sensation. So it's important that you ask the patient what you're intending to do and what you need in terms of response. So I'm going to ask the patient, I'm going to touch you in two different sides of your legs, and I want to know if this feels the same or if it feels different. It's going to matter to me. I'm looking for if there's hyperesthesia or if there's hyperesthesia, if there is pain or if there is a difference, how it compares from one side to the other. So the patterns are, with the dermatomes, are going to be L1. We're going to go from lateral to medial, and I'm going to use my two fingers to stay consistent. Does this feel the same? L1 is kind of in that inguinal crease or different. L2 is midway through the thigh. Same or different? And this is L3. Does this feel the same or different? L4 is going to have the medial side of the calf all the way down into the arch. L4. L5 is going to be the lateral calf all the way to the dorsum of the foot. S1 is going to be into the Achilles tendon posterior, and the popliteal region will determine S2. Does the sensation feel the same or different as you're touching it? From that point, I'm going to go ahead with myotome testing. Myotomes, you got to remember, we're going to test the nerve firing of the muscles, not necessarily a manual muscle test. We're looking to see, are the muscles responding to the commands and to the neurological wiring that takes place. So I'm going to have the patient sit up nice and tall. I'm going to do L1. She's going to raise her leg up and hold. Don't let me move you. Don't let me push you down. I'll go to the other side. Bring the leg up. Hold and don't let me move you. Good. I'm going to go into knee extension, checking the quadriceps. I'm going to ask the patient from this position, can you hold? Don't let me move you. I'm going to ask the patient to move her ankle up and down from this position. As she brings her foot up, I'm going to ask her to hold here. Don't let me move you. L4. Bring the toe up into extension. That's L5. Then I'm going to ask her to relax her foot. I'm going to bring her into an E version, and I'm going to ask her to hold. Don't let me move this position. This is S1. Very quickly, I'm going to ask her to push my hand away. This demonstrates S2. I'm going to compare the other side. We're going to go back to L3. Can you hold this position? Don't let me move you. That's the quadricep. Can you bring your ankle up and down? Notice how my hand placements change as I go down the limb. Bring that foot up, hold that in dorsiflexion. L4. Bring the big toe up. Extensor hallucis longus is L5. I'm going to position the patient into E version of the ankle. Ask her to hold, not to move that position. That's S1. Push my hand away is S2. From that position, I'm going to go ahead and do reflexes of the lower extremities. At L3-4, we're looking at the patellar tendon reflex. A key with the patellar tendon reflex, landmarks are the inferior border of the patella and the tibia tuberosity. We're trying to hit right into the patellar tendon proper. From this position, I'm going to try to get 3 good hits. 1, 2, and 3. Well, I missed that one, didn't I? All right. So we'll go over to the other side. Same thing. See how they compare. 1, 2, and 3. I want to get 3 good hits. Allow the reflex to resolve so I get back to it. And then I'm going to go down into the Achilles, S1 area, to see how our reflex is. What's going to be important here is that I have the patient relax. I'm going to take her slightly into dorsiflexion manually, and I want her to stay relaxed. I'm going to strike into the Achilles tendon proper. 1, 2, 3. Compare the other side. Let her relax. If she holds it up and puts it in dorsiflexion on her own, you'll never get the reflex. 1, 2, 3. Reflex is a patellar tendon, Achilles tendon, myotomes, dermatomes, a very complete neurological eval.